Hi, this is Christina with the Sisyphean Journal. Today's June 19th. After awakening from a nap on June 19th in 1984, 14-year-old Gwen's mother found her daughter dead on the bathroom floor. Just 5 days earlier, Gwen had undergone a second trimester abortion performed by Dr. E. Wyman Garrett in Newark, New Jersey. Gwen had been 22 weeks pregnant. At home after her abortion, Gwen had vomited and suffered from abdominal pain and a fever. Her mother called Garrett, who told her that the symptoms were normal and prescribed antibiotics. Gwen seemed to improve briefly, but she took a turn for the worse on June 18th. Her mother called the morning of the 19th, and Garrett said to bring Gwen into the office. Gwen's mother said that she dozed off, and when she woke up, her daughter was dead. An autopsy found that Gwen's uterus had been punctured. Her abdomen was full of pus and adhesions. She died from an infection. When the New Jersey Medical Board investigated Dr. Garrett, they found that he had illegally altered her medical records. Oops, hold on, I have to fix something here. He had also performed Gwen's abortion in violation of state regulations, since at the time New Jersey's regulations required that any abortions past the first trimester be performed in a hospital, and at 22 weeks Gwen was well past the first trimester. She was getting close to the third. He was found to have been involved in other non-fatal injuries. A 16-year-old girl had to be hospitalized with a 1-inch tear in her uterus and a pelvic infection. Again, this was a second trimester abortion that Garrett had performed in his clinic rather than in a hospital, as regulations required. A baby boy had been born alive at University Hospital in Newark after Garrett had initiated a saline abortion. That little boy struggled and lost his fight for life 15 weeks later. And Garrett had sent a woman home from the clinic with a fetal head left in her uterus. And just to show that he wasn't prejudiced against his abortion patients, he also botched deliveries. A baby girl suffered severe brain injury after Garrett failed to diagnose intrauterine growth retardation and allowed the mother to go into prolonged labor, which deprived the baby of oxygen. Now, Garrett argued that he was suffering from burnout syndrome caused by performing more than 2,600 second trimester abortions between 1982 and 1986. He asserted if any man had this much work, he's going to have complications. But he pleaded no contest with the medical board. So, in 1986, so 2 years after Gwen's death, the board concluded that Garrett was guilty of gross negligence, abandonment of patients, and professional misconduct. He failed to recognize and treat complications in a timely manner. They banned Garrett from performing abortions or any other outpatient surgery. And in 1987, they finally got around to revoking his license, citing a total of 26 abortions performed in a grossly improper manner. As of 1994, he had still owed over $175,000 in fines and court costs from medical board suspension proceedings. And if you follow the link below, you'll see that there were other things he did that were highly questionable. And also in 1986, 2 years after Gwen's death, a whistleblower claimed she had discovered that Garrett was preparing post-operative reports prior to surgeries that he was performing at University Hospital. And likely these were his second trimester abortions, because he did not when did he stop doing abortions? Oh no, he'd stopped doing them in 83. So, not sure what the procedures were. But doing the post-op reports before the abortion, before the surgery, is something I've commonly seen in abortion cases. So, they dragged their feet, but at least they did yank his license, and although other patients did suffer, at least nobody else died. So I guess, thank God for small favors.